Welcome to Public Health America, a weekly program produced by BronxNet in partnership with Mercy College. I'm your host, Dr. William Latimer. Here on Public Health America, we speak with experts from an array of specialties across the liberal arts and health professions to provide you with not only the best science, but practical tips to live a healthier life. We also celebrate what studies have long documented, namely the unparalleled value of a liberal arts college education by setting the stage to pursue a career of your choice, increase lifetime earnings, and engage in civil debate. Our experts will share decisions they made and support they received that helped them to beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Hi, welcome to Public Health America. I'm your host, Dr. William Latimer. It's my pleasure to have with us today Dr. Jonathan Platt, Professor of Epidemiology at the University of Iowa College of Public Health. Jonathan, welcome to the program.
Thanks for having me. It's great to be here.
Thanks so much. So I know you've been doing some cutting-edge work on mental health disparities, particularly among young people. Tell us a little bit about your work.
Yeah, I'd love to. So I am an epidemiologist by training, and specifically trained in psychiatric epidemiology, which is basically the sort of distribution of mental health in populations. In public health, we're interested mostly in, why some people get sick and why others don't. And I'm particularly interested in why some people develop mental health conditions or have mental health challenges. In particular, why those risks and the mental health conditions that we see are different between different racialized groups, between men and women or girls and boys, and differ on the basis of sexual orientation and gender identity. So that's sort of broadly what I'm interested in, and I think it's getting a lot of attention in the mainstream media and news right now, sort of what's going on with young people and mental health. And so it's, I guess, a good time and sort of a concerning time to be a psychiatric epidemiologist.
So it doesn't, you can pick up a USA Today, if that exists anymore, or something, that is sort of available to lay audiences.
Mm-hmm.
And you don't have to go very far to read that mental health issues have really skyrocketed by virtue of the pandemic and all the stress related to it. Has that compounded health disparities in some fashion, or what are the linkages there?
Yeah. So I mean, the pandemic has laid bare, I think, more broadly than mental health, has sort of laid bare a lot of the patterns and the challenges that have been ongoing prior to 2020 and the lockdown and everything. I think there was definitely an exacerbation due to the isolation and the sort of generalized anxiety that everyone in the world probably felt. There were people who were at certain, people, youth and adolescents who are at a particularly vulnerable age, having, their school shut down and all of that, that we're all very, very familiar with. But I think that there are broader issues and broader trends that were ongoing prior to the pandemic that we are seeing, have been exacerbated to some extent and to some extent have not. And one of those things is different racial patterns and trends in mental health, and of course the ongoing disparities that are seen among individuals who identify as gender non-binary and non-heterosexual adolescents and young adults. So I think things have been, I guess, sort of to generally answer your question, things have been worsened by the pandemic, and more for some groups than others.
Got it. So I have a kind of general question, and then I want to get to the disparities issue with more specificity. So I was doing some reading and also discussing with some colleagues the impact of the pandemic on younger people, particularly, say, someone who was starting school, say kindergarten, first, second grade when the pandemic hit. They were taken out, then they come back, and for a year, they're wearing masks. So not only have they missed socialization at a critical point developmentally as a 5, 6, 7 year old, but now they're back and this is all they can see. Meaning a big, and I am not an expert on this, but which is why I'm asking you, just seeing facial cues of emotion, happiness, anger, anxiety, sadness, whatever, that it's just tough to read those cues when you're just learning how to read them in a social setting. And now that's compounded by a mask. And to what extent do we know even the extent to which that has played a part where now you've got a second grader, a third grader, a fourth grader, and as a population, they just seem more aloof. They seem more disconnected. And I've talked to many parents and many people that feel this. Again, it's not empirical, which we know, goodness knows what the truth really is. But is anybody looking at that in terms of research or other things? Of not only the separation, but just the ability to learn how to read social cues when you're going to school at 7 and everybody's wearing a mask.
Yeah, that's a great question. I think that's one of dozens, if not hundreds of questions that I think are still there's not a lot of consensus about. I think they'll take years to fully understand the impact of those kinds of changes, social and structural changes, and also how the difficulties in sort of separating the effect due to any one policy or any one change from what was sort of normal prior to the pandemic and the policies that were put in place. I think it's also important to sort of balance the other experiences or the other exposures that were maybe avoided by wearing masks and potentially the exacerbation of COVID infection and the shutdown, shutting down in the case of having just slow down COVID transmission within a school, beyond the sort of acute response where schools across the country were shut down. So I think to answer your question, yes, there are people who are studying that. I'm not I think more in sort of a child developmental psychology area. There's some attention being paid to those kinds of things, but I think it's on people's minds and trying to understand if and what the long-term implications of those kinds of changes have been.
Got it. So let's do the drill down on the disparity piece.
Sure.
Talk a little bit about, are there specific conditions, disorders, anxieties, depression? I mean, like put some legs on what we're really talking about when we're saying there are mental health disparities among children.
Sure. I'll try to do it as briefly as I can. So starting with gender disparities. So many of your viewers are probably familiar with the new CDC report that just came out, the Youth Risk Behavior Survey, latest wave of data, I think from 2021, which showed increasing disparities in depression and anxiety, and the anxiety that's so strong where you are unable to or unwilling to leave the home, and feelings of suicidal behavior, feelings of contemplating suicide that have been greater among adolescent girls and boys. Rates of suicide and suicidal serious suicide attempts have been higher among boys than girls, but the sort of gap between boys and girls has been slightly decreasing in recent years. Racial disparities in suicidal behavior as well there's evidence that they've been decreasing. Again, white youth have been historically more likely to commit suicide than African American and Latino and Asian American and Pacific Islander youth. that gap has been closing in recent years among young people specifically. Of course, I don't want to forget about the large excess of suicide among Native communities across the country. That's been historically much higher than any other group. And I think sort of, and then also really since we've started tracking, sexual orientation and gender identity, those groups have been historically at greatest risk for, depression, anxiety, suicidal thoughts, suicidal actions, and we're seeing sort of the conversation and policies that are being enacted across the country, really creating sort of greater environments with greater hostility towards these individuals in these communities. I do want to just mention also, this is sort of depression and anxiety and these kind of internalizing conditions that can sort of be grouped in that way, are also occurring in the face of patterns of decreasing alcohol use and sort of these other externalizing behaviors and externalizing conditions. So it's sort of these countervailing trends where, I think it's still, the jury's still out as to what's going on generally with young people, but evidence is trends are not good.
So let's start with girls and then move to the non-binary LGBTQ plus populations. So I've also read that suicidal thoughts are on the rise among pre-adolescent and adolescent girls.
Mm-hmm.
When I think of non-binary LGBTQ plus, they're experiencing so much microaggression and so much, if you will, institutional discrimination that maybe it's overly simplistic, but at least I understand it. And feel free to expand on that or to
Mm-hmm.
Revise what I just said with something more accurate. But what's going on with girls? Why is there an increase? Is that related to the pandemic? Is it separate? What's going on there? What do we think?
Yeah, great question. I think there are plenty of theories out there. I don't think it's any one particular thing. I just have a review trying to answer this question, or at least sort of review the literature that has been put out there to answer this question. And of course, social media gets a lot of attention. Is that exacerbating problems broadly? There's some evidence that it's, girls and young women face greater hostility, cyberbullying, stressful kinds of experiences, body image, issues, sort of invidious social comparisons, the negative aspects of that and stressful aspects of that. I think that literature just needs to come to greater maturity. We need to be better at measuring what we mean by social media use. Right now, the research is pretty limited by pretty crude measures of what people are doing, how people are using social media, and what they're doing when they're on social media. So, again, more information is needed to understand that. I've read, others have theories about the decreasing age of puberty. That's decreased, age of onset of puberty has decreased historically over the past century or so for girls more than boys. And whether or not that sort of is related to mental health is another question that's being actively investigated too, among many others.
Sure. So look, you've addressed a lot of complex issues clearly. With just a few moments left before we go to our next segment of this show, what do we do with all of this? Like, what's the public health policy implications that will help young people to navigate their emotional status better?
Mm-hmm. Yeah, that's the question. We should be doing this research so we can intervene, so we can make adolescent developmental environments more supportive of youth. I think first of all, and what I tend to focus on is really isolating and identifying causes of these trends that we're seeing, these population level trends. So we know what matters most, what's most important to look at and to potentially focus our interventions on. I think we can do a lot better in creating supportive environments for students, within families, within schools, within other sort of key locations for adolescent social interaction and development. Another part of this conversation is just the utter lack of formal mental health services for young people, for everyone in the US, but in particular for young people. And we're not going to, hire and train mental health our way out of this problem by training more formal mental health providers. It's just not within our capacity to do. So I think identifying important and effective sources of informal support for young people, and potentially leveraging, some of these exposures and these new locations where that have become ubiquitous. What can we leverage from social media and the smartphone in every adolescent's pocket to help to create supportive mental health supports and to give them the benefits of the technology and instead of just the risks.
Sure. So a compelling topic, an important conversation. We're going to take a quick break. When we come back, Dr. Platt will tell us a little bit about his educational history, particularly as an undergraduate, and how that set the stage for his career and profession. This is Public Health America. I'm your host, Dr. William Latimer. We'll be right back.
You can now watch MNN, Brick TV, QPTV, and SIC TV on BronxNet. Tune in to BX Omni, Channel 67 Optimum, 2133 Fios during most Sunday evenings. We'll show you some amazing content from our friends at Manhattan Neighborhood Network, Brick TV in Brooklyn, Queens Public Television, and Staten Island Community Television. Every borough represented in the Boogie Down. Epic partnerships for the ages. And catch our new Next channel, produced in partnership with MNN, 24/7 on BronxNet Channel 952 Optimum and 2138 Fios.
You can talk to me if you're feeling sad.
Thanks for hearing me out, bro.
Whenever you need to talk, I'm here, okay?
How do you know when you've made the right decision? It's the feeling you get in your gut. The one that tells you what's right or wrong. It's the one that says, sure, I can have a drink. Or the feeling that says, okay, I've been drinking. Now what? It's the voice inside you that says, I'm buzzed. Better leave the car when it's time to go. Plan ahead. Catch a sober ride. Buzz driving is drunk driving.
Welcome back to Public Health America. I'm your host, Dr. William Latimer. So, Jonathan, I always open this part of the segment with the exact same question, which is, tell us where you were born and about some of your formative experiences.
Yeah, so I was born in Madison, Wisconsin, and grew up in a smaller town near Madison, in Wisconsin, a small college town. I thought, sort of in hindsight, it was a little tough growing up in a small town, but in hindsight, I really valued living in a place where there was a sort of a university community and there was that infusion of creativity and intellectual sort of pursuits and, all of the kind of community that fostered. I went back to go to college. I went back to Madison. I went to the University of Wisconsin and majored in anthropology and environmental studies. Sort of a classic liberal arts education, social science education, which I was interested in. I was pre-med as well, sort of thinking that was going to be my track, going from undergrad to medical school, maybe working a little bit in between. But in fact, I ended up joining the Peace Corps right out of undergrad. So I spent 2.5 years of my post-baccalaureate life in Malawi, which is a small country in Sub-Saharan Africa, working on sort of community development and forestry and environmental type of projects. But that's where I really sort of got interested in and saw the importance of public health and community health. And the kind of the value of really distal and really sort of fundamental public health prevention or health prevention efforts, and the kinds of impacts that could have before people become patients and visit the clinics and seek health services in that way.
Sure. I mean, obviously, University of Wisconsin-Madison is an exceptional institution. Tell us a little bit about your time there. What were some of the challenges, if there were any, that you faced, and what was that journey like?
Sure. So I loved my time there, my 4 years in Madison. It's one of the a very large school, one of the biggest schools in the country, Big Ten school, and that has advantages and disadvantages, of course, or challenges and opportunities, I would say. There's something for everyone there. Really, really excellent school for a lot of different things. And you can find your own niche and your own scene, and socially there's everything going on. One challenge that also comes from that, sort of the flip side of that coin, is it can be really hard to sort of keep a direction, and you can it can be sort of easy to lose your way, or feel like you're completely anonymous and get sort of swept away in the sort of the sea of undergrads as you move through your underclassmen to upperclassmen kind of trajectory. And so it was a challenge at times to sort of maintain a relationship with an advisor and other faculty, and pursue those opportunities that allowed me to build those relationships and sort of develop an individual sort of learning experience.
Sure. And that makes a lot of sense. And I mean, there's always that tension between, a large school that provides, seemingly endless opportunity, versus a college like Chestnut Hill College, where I am, that has 1,400 students and everybody knows the names of everyone's children. It's not that can't happen at Madison, Wisconsin. Of course it can, but at Chestnut Hill College in Philadelphia, it always happens. There's no, and that's a strength. So it's finding the right fit, I think, right?
Yeah.
And sometimes that's even developmental in terms of what phase, of your life you're in. You had mentioned obviously the Peace Corps. That's extraordinary, and obviously I'm sure the experience in Malawi was fantastic. Did you have other experiential learning opportunities during your undergrad years, or other things that sort of complemented your in-class learning?
I did, yeah. So I was, like I said, I was an anthropology major, and specifically I was actually really interested in archaeology, and spent a summer on Easter Island, where I was, there with a faculty research group who had a field site there, and spent about 2 months on Easter Island, measuring and doing spatial analyses of the moai, the big statues that everyone's probably familiar with, and then doing a lot of the more tedious work that doesn't get a lot of attention when you hear about archaeology, or you watch, the Indiana Jones movies, those kinds of things. Digging 1 meter by 1 meter by 1 meter cubes in the dirt and the sand, and screening those. So that was sort of, I thought I really valued that as sort of a real opportunity for real world experience early in my training, before I decided, whether or not if this is what I wanted to do, to go down that road, grad school, that kind of thing. But also, had a really wonderful time being there, and being in such a unique place with such a vast and interesting history.
Sure. So you go to the Peace Corps, and during that period, in other words, these days, everyone knows what an epidemiologist is by virtue of the pandemic, whereas prior to the pandemic, I'm not sure 30 people knew what an epidemiologist was, minus epidemiologists themselves. What led you to epidemiology as a field of study, and what was your next step educationally after the Peace Corps?
Yeah, so I guess part of my realization about, like I said, the importance of community health and preventive health at the sort of public health and community level, was a realization that I didn't think that getting an MD or becoming a doctor in that respect was the way to get to have that be the focus of my career. So then the next question was, oh well, what could be? And talking to former advisors from Wisconsin and other people. My mother was a nurse, sort of was the one who inspired me to do the Peace Corps in the first place. She spent a good chunk of her early adulthood doing similar volunteer work and service work. So talking to her and talking to other people, the doctors that I had shadowed and people that I had worked with, sort of turned me on to epidemiology as the quantitative, one of the primary quantitative methods for public health. So epidemiology is a set of methodological skills and thinking. Actually, the best definition that I like, the definition that I like most of epidemiology is population thinking and group comparison. So it's a set of methods that sort of allows you to, a framework for the way you can think about how, disease occurs in populations. And I guess I kind of came to it in more or less an organic way in sort of surveying the field and what made the most sense for me. So I returned from the Peace Corps and started to apply for graduate programs, Masters of Public Health, and actually ended up attending Columbia University in New York and getting my MPH there, and continuing at Columbia and getting my PhD in epidemiology there, and was really lucky to have a great set of mentors and advisors there, and sort of put me on the trajectory that I'm now still on.
Sure. Columbia School, Mailman School of Public Health is exceptional, no question. New York City, like Philly, great environment to study those methods. So you've had a variety of really rich experiences. You've done work in the Midwest, you've done work on the East Coast, you've done work in Sub-Saharan Africa. What do you see as sort of the next few years of your career? What are the things that intrigue you the most?
Yeah. So, as I was saying, with what's going on with youth, I'm trying to understand what the causes of, the trends that we see and the group disparities that we see. I'm all in on that. And I think in particular, the suicidal behavior and youth suicide in particular, very, very important. Also now working and being at an institution that has a big focus on rural populations, I'm really interested in and appreciative of the role of a public university, the University of Iowa in this case, as a public institution for understanding the issues that are particularly being faced by the communities in which in which we all live and reside out in Iowa. That can look any number of ways, but I'm excited to have that be a big focus of my research in the next few years.
That's great. I want to thank Dr. Jonathan Platt for joining us today. I want to thank our viewers for tuning in. This is Public Health America. I'm your host, Dr. William Latimer. I'll see you next time. Until then, take care.